You might have heard the pandemic is over. That news seems important. Virus that killed 1 million plus of our fellow citizens, changed the economy, ruined lives, kept us away from our grandkids, kids, our parents. Well, it's over, or so says President Biden.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
Just a few quick thoughts. What? Really? We can all now just go back to normal life? Not quite. Remember President Biden on the campaign trail.
We're going to beat this virus. We're going to get it under control.
It's going to take patience, persistence, and determination to beat this virus.
But I'm confident we will beat this. We're not going to get our economy back in shape and the millions of people back to work until we beat this virus.
I will do everything in my power. I will not relent until we beat this virus.
Okay, so he became president saying he would end COVID. He would beat the virus. Yet when COVID ends, when he has succeeded, he announces it on 60 Minutes in a throwaway line and heads off to the Queen's funeral. No White House event, no big celebration with school kids now unmasked, no big family celebrations of everybody getting together. The White House threw a celebration for the Inflation Reduction Act on the same day inflation exploded. But nothing save just a quick interview on 60 Minutes for the end of COVID. Perhaps that's because his chief medical officer disagrees.
We are not where we need to be if we're going to be able to, quote, live with the virus, because we know we're not going to eradicate it.
That's Dr. Fauci today. And Democrats also disagree with the president. Mehdi Hassan over on MSNBC just tweeted, one of the many reasons they're not wearing masks is because people like Biden keep falsely telling them the pandemic is over. Hassan was responding to a picture of Mr. Biden at the Detroit Auto Show, walking around, as you saw in 60 Minutes, maskless. The left is mad at Biden for ending the pandemic. It almost doesn't make a lot of sense, because that's what he and Democrats ran on. Heading into the midterms, you'd think that Democrats would be running on the concept that President Biden ended COVID, but they're not. Here's just some of the outrage online. A pandemic isn't like bootcut jeans where you look around at what people are wearing and declare it's over. Biden was so irresponsible, short-sighted, and inaccurate, I don't care that he also said COVID is still a problem. In a society where people can't even be bothered to read past a headline, you think they're going to bother to hear past his saying the pandemic is over. Biden is saying the pandemic is over as transmission rates stay high. Americans with long COVID outnumber immunocompromised Americans. 4 million workers are sick. As at-risk people scream for safe access, transportation, and education. Make this make sense to me. The problem with saying it's over is then all of a sudden you can't claim emergency powers like universal mail-in voting. Not anymore. Trillions in spending. Well, there's still a lot of money left to spend that Democrats would like to keep at. Title 42 down on the border. Well, COVID's over, the pandemic's over, that ends too. How about firing unvaccinated teachers like they are doing in New York this week? Well, no. If it's not an emergency, if the pandemic is over, how do you fire people for not having the shot? Congressman Tom Massey tweeted this: if the pandemic is over, as Biden says, then all of the president's emergency powers predicated on a pandemic, all COVID vaccine mandates, the emergency powers of every governor, emergency use authorizations, and the PrEP Act should all be voided tomorrow. Makes sense. I used to be a White House correspondent, and this is the curious part. An announcement like this, major policy announcement, a huge victory for the White House, usually involves weeks of planning, events, messaging, rollouts. An interview with 60 Minutes involves hours of prep work. Clearly not here. Everyone was caught off guard. The White House was caught off guard. There were no events today to celebrate the end of the pandemic. The president just sort of said it. The White House comms team lucked out, though. The president's flying back from London. They don't have to explain exactly what he meant, nor do they have to explain why they still want pandemic powers after the president said the pandemic is over. Save that thought for a second, because there is a new pandemic. The World Health Organization said climate change is the single biggest threat facing humanity, and health professionals worldwide, quote, are already responding to the health harms caused by the unfolding crisis of climate change. Yes, the same World Health Organization that covered up for China during the start of COVID and likely contributed to the deaths of hundreds of thousands of people in the process. January 10th, WHO discourages travel bans. This is back in 2020. January 14th, no human-to-human transmission, even though there was massive evidence otherwise. January 30th, they delayed declaring an international health emergency. March 19th, they warned against calling the virus Chinese. March 28th, the WHO claimed COVID not airborne. February 9th, 2021, despite a lot of evidence, they denounced the lab leak theory. So the same World Health Organization that covered for China during the outbreak of the virus, and the same World Health Organization that continues to obstruct an investigation into where the virus came from, now echoes Chinese talking points on climate change. China's climate envoy blames the U.S. for Beijing's decision to halt climate talks. China accuses U.S. of deflecting blame as diplomatic row shifts to climate change. China delivers diatribe against U.S. climate policies. This is the Chinese view. So we are clear. It's wrong to talk about where the virus came from, but on climate change, we really need to place blame on where climate change came from. Of course, not what's causing climate change right now. The Chinese don't like to talk about that because they emit more CO2 than the United States, India, and Japan combined. Who? This could kind of be important. Is head of the World Health Organization? Well, one of China's best friends. Here's President Xi with his man. China's just fine with how Mr. Biden ended the pandemic because of what he didn't say, what he never has said and likely never will. Certainly didn't announce it on 60 Minutes. A 9/11-style commission to investigate the pandemic. Something like the Warren Commission from the JFK assassination or the investigations after Pearl Harbor. We've been asking about that for months. 1 million+ Americans died during the pandemic, ruined and changed our lives for years. You'd think we'd want to get to the bottom of all of the problems of the pandemic. A Blue Ribbon Commission, 9/11-style commission, January 6th committee-style investigation, so we can fix all the problems. That didn't happen, won't happen. We'll just move on to the next emergency, climate change with China. With the World Health Organization leading the way, because that worked out so well over the past 2 years. Dr. Amish Adalja is here, professor of public health at Johns Hopkins University. Doc, it's good to see you as always. Now the pandemic's over. If this is the last time we talk, I just want to say it's been a pleasure having you here for many, many months and years to chat. I don't think it will be the last time. Do you have any idea what the president meant by that from a medical perspective?
I think from the medical perspective, I agree with the president that we are not in the same throes of the pandemic that we once were. COVID-19 has largely shifted to an outpatient manageable illness. We have vaccines, boosters, monoclonal antibodies, antivirals, rapid tests, surveillance of wastewater, where we've made it a much more manageable infection, one that can't compromise hospital capacity. So in that sense, I agree with the president. And I think that people don't realize it's not binary. It's not pandemic versus zero. There still are 500 people dying every day on certain days, and that means that there's still work to be done. But it's not as if it's not a pandemic, that doesn't necessarily mean that you have to forget about it. And I think that's what's sort of missing in this discussion, is that it's still a public health emergency, even if it's not a pandemic. Not every public health emergency is a pandemic, and we still have work to do. But I think that we are in that endemic phase where this is something that is much more manageable and not able to crush our hospitals the way it once could. And I think we should recognize that.
The word you may be looking for is nuance, which almost is always missing in politics and needs to be present in medicine. At least certainly need to be present over the past couple of years. In some ways, is the president also a little late to the game, acknowledging what you're saying and perhaps what most of America is feeling, that they want to get on with their lives? They want to have a normal Thanksgiving and a normal Christmas because, as you said, it's unlikely a healthy person is going to be killed by COVID at this point?
I do think that it's late in recognizing how far we've come in terms of the medicine, science, and technology that have made COVID-19 more manageable. I've been saying it for some time that COVID-19 has become something that is much more manageable and not something that had the same level of threat that it once did. And that's something that we should celebrate. And I think the president's kind of gotten tied up in the semantics of how people think about pandemics. And the general public doesn't think of pandemic as just meaning, a big infection going through the population. They associate it with deaths. And I think the fact that they're seeing that there are hundreds of deaths per day, that doesn't comport with how they think of the word pandemic. But I think strictly speaking,
it's a great point. I guess I want to just get you on this last point. We got 30 or 45 seconds. The idea that the World Health Organization is now talking about climate change, which is about as political of a discussion as you can get. Do they have to be pandering to somebody if they're doing that, or are they just pleading for relevancy?
I'm not, a climate change expert, and I don't want to get into things that I'm not a subject matter expert upon. But I know that the WHO is a political organization that is very responsive to its donors and the priorities of its donors. And that's sort of what we saw with COVID-19, that we saw reticence to declare, as you mentioned, that this was a public health emergency of international concern because of deference to China. We saw the same thing happen with Ebola outbreaks in 2013, 2014, a lot of dithering and stalling because of political pressure. And I think the WHO needs to be a much more independent organization.
Deference to China being the key words there. Doc, it's good to see you as always. Thank you. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.